I am a pensioner from Our Lady of Fatima Hospital, a nurse of 37 years there, as well as president of United Nurses and Allied Professionals.
So what brings you and your group out here?
We're out here today to bring attention to the bishop to do what's right for all of the pensioners that committed many years of service at St. Joseph's Health Services and Our Lady of Fatima Hospital. He is the last man standing. We have settled lawsuits with multiple other litigants in the case, and the church has refused outright to even sit down and try to come to an agreement to do what was right.
And what's the church's involvement, and why are you going after them?
To us, the church is the most culpable in this entire experience. This was a church-based pension. The bishop was the chairman of the board. The bishop had ultimate control over that pension. So they hold the most responsibility to make sure that that pension was funded appropriately and correctly, and 2,700 pensioners can go into retirement knowing they have the security of a pension.
Is this the first time you've come out and picketed him personally?
Personally, yes. This is the first time, but will not be the last time.
And why come out here today?
We actually got notified by the pensioners that he was going to be here. And they said, we really felt this was the appropriate time to come out and let him know we're here and we're not going away.
You're in court. Are you in court with the diocese?
We are in court with the diocese. They were forced into some mediation, arbitration type discussions that hasn't gone anywhere. So now we're waiting to get on the docket to be heard in court. They've made claims that this is a fraudulent lawsuit, that it has no validity, but this has been now in the courts for 5 years. And if it was fraudulent or didn't have any credibility, the courts would have thrown it out a long time ago.
Is it frustrating to be in the position you're in?
Extremely frustrating. And it concerns me for all of those retirees who are waiting and worrying that they could lose 40% of their pension. And that's just not right. These are people that committed their livelihoods and their life to St. Joseph's Hospital and serving the Catholic community.
Then you have a dual role here. You're also a union president.
I am.
The nurses union.
That I am.
So you're well versed in these matters.
I am well versed in these matters, and we felt betrayed as well as the nurses union that represented a lot of these pensioners. When the sales went through and the mergers went through, we were given guarantees that the pension was funded and funded appropriately and that it was secure for all of the retirees. And we're learning that's not true.
They sold the hospital and sold the pension liability? Is it, or you say no?
No, you can't sell the pension liability. They can make claims on what it was funded and how it was funded. And now we're digging deep to see whether those documents were actually accurate.
What would you say to the bishop, given the opportunity?
I'd like to sit down with him and say, do what is right. Do what's right to the healthcare workers that committed themselves.
Here he comes. Well, I get the chance.
That's it. Bishop, we ask you, please do what's right for pensioners. Sit down, talk with us, do your moral obligation to fund the pension appropriately.
Bishop, you want to talk about the pension?
And that's basically what we get.
And that's
A smile and a nod, and I'll pray for you. We need more than prayers.
And Blaze, thank you.
Thank you.
Yes, thank you.
Thank you.
I appreciate it.